I'm Chase Gruening with Gruening Health and Wealth. In this video, I'm going to break down the foundations of Medicare, general enrollment information, different enrollment scenarios, and the major exposures of Medicare, so you can make confident Medicare decisions and stop guessing. So we're going to get right into it here. Original Medicare, this is the foundation of Medicare. And when I think about the foundation, we think about building a house. This is that foundational portion of the house. Medicare A and B, which is your foundation. Medicare A, and let's really, if you're writing things down, this is a time to start writing things down. Medicare Part A, when we talk about Medicare Part A, that's going to be your hospital or inpatient coverage. Medicare Part B as in boy, that is going to be your doctor or your outpatient coverage. And Part A, that's going to be typically zero premium. You will not pay for that as long as you worked 40 quarters or a spouse worked 40 quarters. And that is something you paid in through your taxes, and that is one of your entitlements. Part B does have a monthly premium. Here in 2026, that monthly premium is going to be $202.90 unless you are a high or low income earner, and that can fluctuate. Most people are going to pay the standard amount, which will be $202.90. So make sure you're writing that down. Your Part B premium will be $202.90. Your Part A premium typically is going to be zero premium or free. Now, when do I enroll in Medicare, or how do the enrollments affect me, or will I be automatically enrolled? Well, a lot of it is going to be dependent on these three scenarios. So I urge you, as you're writing things down, to identify which scenario do you fall into. Scenario 1, you're currently receiving Social Security benefits. Scenario 2, you are not receiving Social Security benefits. And Scenario 3, you're not receiving Social Security benefits and you're still working. So those are the three different scenarios that you could fall into. We're going to go over each one of those. So Scenario 1, this is if you're drawing Social Security. This is the easiest scenario. You're going to be automatically enrolled into Medicare Part A and B. And if you do not want to be enrolled in Medicare Part A and B, we need to unenroll you or disenroll you from Medicare Part B. So again, this is the easiest one. You should receive your Medicare red, white, and blue card about 3 months before you go onto Medicare or turn 65. Scenario 2, you're not receiving Social Security benefits. Let's go a little bit deeper here. Maybe you're not receiving Social Security benefits and you're not working, right? And you want to go into Medicare. Well, this is going to require manual enrollment. And you can do this a number of different ways. You can do this online, ssa.gov/benefits/Medicare. You can do it over the phone. There's the phone number right there. You can do it in person by mailing, you can do it in person, go to your local Social Security office, or you can do it by mailing. If you do not enroll in Social Security benefits, if you do not want to enroll in Social Security benefits and still enroll in Medicare, you're going to be billed quarterly. So $202.90 times 3 equals $608.70. You'll receive a quarterly bill until you enroll in Social Security benefits, and then that monthly deduction will be automatically taken out of your Social Security once you start drawing there. So don't want to over confuse you there. If you're not drawing Social Security benefits, let's really simplify this. If you're not drawing Social Security benefits and you want to enroll in Medicare, we have to do that manually, and we can help you do that. And then here's a couple ways to do it on your own. Scenario 3, okay, this one's a little more planning, a little more side-by-side guidance, I would say here. So Scenario 3, if you're still working and you're covered under maybe a spouse's or an employer plan, this one takes a little bit more. Let's get this side by side. Here's my recommendation here. If you have an employer plan, you have a spousal plan, we need to make sure we're putting them side by side and understanding, is the employer plan, is the spouse's plan going to be the best option for you? So many times we see Medicare being a more comprehensive option in terms of coverage and a less expensive option than your employer coverage. Or your employer coverage is missing some key umbrella components that we're going to talk about throughout this webinar. Now, if you don't enroll into Medicare and you have employer or union coverage or spousal coverage, you can delay Part B of Medicare with no penalty. But again, I urge you to book a one-on-one call, and we'll lay it out side by side and help you understand which option is going to be the best for you based on cost and coverage of both plans. Now, when does your Medicare enrollment start? Pretty simple here. Your Medicare enrollment is going to begin the first day of the birth month that you turn 65. For example, if I was turning 65 in August of 2026, my birthday's in August 8th, my Medicare would start on August 1st of 2026. The only exception to that rule, if you have a birthday on the first day of the month, so if my birthday was August 1st, then my Medicare would actually start 1 month earlier. So if you have a birthday on the first day of the month, make sure you understand your Medicare will start 1 month earlier. Major exposures here. So that's what we're really going over today when you break it down, is Medicare only covers so much. That's a common misconception, is that Medicare covers everything. So if I have Medicare A and B, I have my red, white, and blue card Chase, why do I need anything else? That's a common question I get. Very good question. And the answer would be because Medicare has some major exposures that you need to be aware of. When it comes to Part A, on day one, you have a deductible of $1,736 for a hospital stay. If you have an extended stay, if that stay turns into a longer stay, you're gonna pay a daily copay. When it comes to Part B, you have a $283 deductible. Everybody says, Chase, no big deal, $283, I can afford that. Sure. Now, the next part here, that's what you need to be aware of. You have a 20% coinsurance that you're responsible for with no limit. So Part B leaves you with a 20% coinsurance with no limit. So we need to make sure we cover up the coinsurance and the excess and make sure that we have an end in sight more than anything. And then Part B excess charges, if a provider charges more than the Medicare approved amount, there can be an excess charge as well. So those are some of the major exposures we need to be aware of.
If you want help making sure you're covered correctly or have any further questions about anything I've gone over today, there's a link in the description below where you can book a one-on-one call with our team. Also, feel free to drop any questions you have in the comments below. I'll be sure to go through and answer those personally. If you've liked today's video or want to see more of our content, make sure to hit the like button below. Subscribe so you don't miss further videos or guidance on your Medicare journey. Again, Chase Gruening here with Gruening Health and Wealth. Thanks for joining us.